Okay, hi everybody. We're just going to go through the notes for this particular module. This is the beginning of the unit of Unit 12. I combine Unit 12 and 13 because we're talking about abnormal and clinical psychology and then the treatment. So it's kind of about 18 to 20% of the AP exam in total. So it's a big, significant unit. So I do want you to make sure that you're watching these short videos, you're going through the notes, and then maybe you follow up reading the chapter, the module, and doing the reading guide right after it. Just to recap my first video that I posted, each day you'll be getting, that we meet, we have to have our letter day. So each day that our class meets, you'll see an assignment on Schoology. It's a short video with my lecture. It's another video, which is like a TED Talk or a crash course or something. And then you'll have that third part is an assignment, which might just be some questions, quick questions or reflection in Schoology that you'll post back to me by 11:59 that night. Or it might be AP Classroom questions. And I'm going to try in AP Classroom not to do any questions that involve that lockdown browser because I don't want anybody's iPad shutting down because of College Board. Okay, so I'm going to dive right in. Again, this is one of my favorite units. It's one of my favorite units to teach. It's very interesting. Hopefully when we do get back to school, we'll do some case studies together and you guys will do those together and they're very interesting. But, you know, I want everybody to, you know, be sensitive in this unit because we are talking about mental illness and mental disorders. So if you have any questions about anything, don't hesitate to email or we can maybe log in and do a Google chat or something if you have specific questions about it. Okay, so we're going to start off by my objectives. Rob Loya would be very happy. Okay, so we're going to start off with, you know, kind of just defining what a psychological disorder is. Not everything that we have, like if we're feeling depressed one day or we're feeling anxious one day, it doesn't mean that we have a psychological disorder. In order to have a psychological disorder, you have to have, you know, these patterns of thoughts, these feelings, these actions that are kind of distressful and disturbing and dysfunctional, like over a period of time, and it interferes with your day-to-day life. So, you know, all of us are going to experience, you know, being depressed occasionally or sad or anxious, but it doesn't mean that we have, you know, the mental illness. We could, and that's okay, but it's interfering with your day-to-day life. So you're not being able to get out of bed, or maybe you're not going to school, or those kinds of things are interfering. So again, it's a syndrome that's marked by clinically significant disturbance in an individual's cognition, their emotion regulation, and their behavior, okay? And those behaviors are they're more maladaptive, which basically just means that they interfere with like your normal day-to-day life, okay? So I put a spider in here, just, you know, a lot of people are fearful of spiders, but, you know, it doesn't interfere with my day-to-day stuff. You all know I'm terrified of spiders and I hate seeing spiders or bugs, but I still go on and I work and I do all those things. It doesn't interfere with my day-to-day stuff, okay? All right. So I'm going to take you through kind of like the history and then kind of where we are today with how we classify disorders. So, you know, back in the day, we kind of talked about this in Unit 1 where they really blamed everything on the devil did it, or, you know, if you were in asylums, they just threw you in there. There was not a lot of good treatment for mental health way back in the day. So sometimes it ranged from pulling teeth to body mutilation. That was way back in the Middle Ages. And remember Dorothea Dix, she was huge in the, you know, the kind of really humanizing the asylums and getting proper treatment for people that had mental health issues. She's super important. So remember her, Dorothea Dix. She was the one that was just really instrumental on kind of humanizing mental health, okay? And then there's this medical model, this concept that psychological disorders have physical causes and they can be diagnosed and treated and in most cases cured. So that's the medical model of the treatment. And that's more mainstream and day-to-day now. And then there's this biopsychosocial approach, and that really assumes that all the moving pieces are involved in a psychological disorder. So there's, the biological aspect of it, and that's going to be like our genes, the brain structure, so all our different things that are happening. If we have low serotonin levels, that's going to be biological with depression. So all of those things we kind of learned back from the biology unit, those would be in this biopsychosocial approach. There's also a psychological approach in this, and that's really like stress, trauma. If things have happened, that certainly can contribute to having a psychological disorder. There's like learned helplessness, mood-related, perceptions and memories and those kinds of things in that psychological part. And then there's the socio-cultural part of the biopsychosocial approach. And this is more like roles and expectations like in your culture. So like what's normal in our culture might not be normal in another culture. So those kinds of things definitely, those three things together come up with this biopsychosocial approach to psychological disorders. Okay, so how we classify all of the psychological disorders is in this Diagnostic and Statistical Manual of Mental Disorders. This is this huge book. I have several in my office. And believe it or not, when I first started grad school and we were using this, I believe it was a 3, DSM-3. They tend to change it every 10 years. When I started using it, it was a 3, and then it went to a 3R, and then it was a 4, and then now it's a 5. And there's still been some changes that are coming. I think the 6th edition will be out in the next few years. But this big, huge manual is exactly what you have to have in order for a clinician to give you a certain diagnosis. And I put a little example in here, like you have to have like these certain diagnostic criteria for insomnia. So it like literally spells it out for you. You need these 3 things or 5 things in order to then have that diagnosis. And this is how all the psychologists, psychiatrists, everybody uses this classification system to describe disorders, and then it predicts like future, the treatment planning of it then. So this is used in hospitals, it's used in therapy, it's used like all over the place. So everybody that you'll hear from that works kind of in this field, they will always refer to the DSM-5. And this is how we classify the psychological disorders, okay? So that's a big one to definitely know. This is always on the test somehow, okay? Okay, so it's used for classifying, obviously, the psychological disorders. Okay, Rosenham's study, he was really huge. You'll likely see him on the test as well. What he did was he and some other clinicians, there was I think 8 of them, they all went to hospitals and they faked hearing voices. So they all literally said the same thing. They went to different hospitals. They all said, whatever they were hearing, and they all got admitted to the hospital. And then once they got admitted to the hospital, then they started to act normal. And they were all misdiagnosed with several different disorders. And some were in the hospital, I think up to like 28 days. And he was very instrumental on saying that like labels and labeling can significantly influence perception. So that was really his, he didn't really like the labels. Like if someone has schizophrenia, labeling it, might be good, for the psychiatrist and the psychologist, but then, people might take that label and their perception might be different of that person. So this is a huge study. You're going to watch a video on this in a little bit, but he and his colleagues, they, were normal colleagues. They all, were fine, but they went to these different hospitals and faked hearing voices. Okay, I think that is all I want to go through with you today. Tomorrow we're going to, I'm going to switch gears. I think your reading guide's a little different, but I always like to talk about schizophrenia first. So tomorrow we're going to move into schizophrenia, what the symptoms are in that way. Okay, if you have any questions, email me. I hope you guys are doing well. Take good care.